Welcome, everybody. We're just going to give it a minute or so as folks trickle into the room here. All right, we'll get started. Welcome, everybody, to the AAPI Policy Priorities Survey Briefing with critical insights on the timely policy issues impacting our nation. I'm Toon Nguyen. I'm the Executive Director at OCA Asian Pacific American Advocates and also the co-chair of the Executive Committee of the National Council of Asian Pacific Americans. The survey that we're presenting to you today is a collaboration between NCAPA and AAPI Data and provides an incredibly important resource of data and insights for our communities regarding timely policy and social issues moving into fall 2025 and beyond. So today you'll hear from Karthik Ramakrishnan, founder and executive director of AAPI Data, who will be reviewing the main findings of the survey. Then we'll hear from Greg Orton, National Director of NCAPA, who will discuss key takeaways and call to actions garnered from these data insights. I believe the chat is not active right now, but we do have a Q&A function at the bottom of your screen for this webinar. And so you'll be able to submit any questions. You can feel free to submit those questions throughout the presentation. We will be reserving time at the end so that Karthik, Greg, and I can get to your questions and have a more open discussion with all of you here today. With that, I want to turn it over. Yeah, this call is being recorded and we will have slides for all the attendees afterwards. And with that, I'll toss it over to you, Karthik.
Thank you, too, and hi, everyone. Thank you all for joining us today for these critical insights that we hope will inform various types of strategies moving forward, not only for 2025, but importantly into 2026. Let's go to the next slide, please. I'll just say some key backgrounds in terms of the goals of the survey. At API Data, we partner with key organizations, including in the past and next year, we'll be partnering with API Vote as well as AJC on the Asian American Voter Survey. This is the Policy Priority Survey. This is a survey of API adults on key policy areas that reflect priorities that the National Council of Asian Pacific Americans has. And in the future, we hope that this will be an annual survey that stands in fruitful engagement with the 40+ coalition members of NCAPA. The goals of the survey is to understand what issues are important to community members, to gain a deeper understanding of community opinion on key topic areas like economic hardship, healthcare, and immigration, understand major gaps in awareness that might prompt future efforts at community engagement and community education, and to identify strategies for more effective outreach. Next slide. So a little bit about the methods in the survey. The survey is now up on our website, and you can get more detailed methodology in the cross-tabulation PDF at the bottom of that document. So this survey is built on NORC's Amplify API panel. And the survey was funded by Community R&D and designed by API Data and NCAPA, including members of NCAPA's Strategic Narrative Working Group. The interviews were conducted in August of 2025 in all 50, representing 50 states and DC. And the survey was offered in English as well as in Mandarin, Cantonese, Vietnamese, and Korean that constitute the vast majority of API adults in the United States. The overall margin of error, including the survey's design effect, is plus or minus 4.8 percentage points. Let's go to the next slide. So here are the top line findings. There's a lot of findings that I'll be going through. Next slide. First and foremost, cost of living and inflation is the top issue on the minds of AAPI adults, while only 25% mentioned immigration as the most important issue facing the country. This is in contrast to December 2024. It wasn't the exact same wording, where immigration received the top mention, as 42% of AAPI adults indicated that the issue was important to them personally. 64% of APIs think that Trump and Republicans have gone too far on immigration enforcement, and there's opposition, including strong opposition, to a variety of measures that we have seen since the summer of 2025. Next slide. API adults are highly persuadable on the reconciliation bill. This is something that, as a survey researcher and a political scientist, it's quite dramatic. We conducted a survey experiment, and when we only mentioned the benefits of the bill, their opinion was split, and there was a lot more support for the bill than when we only exposed people to the costs of the bill or exposed them to both the costs and the benefits of the bill. We'll say more about that in a bit. 56% of API adults said that healthcare costs were the most difficult item for them to afford. And when it comes to solutions, supermajority support government regulation, including placing limits on the cost of prescription medication. Importantly, this is the Mamdani question. What do people think about freezing rent? There is broad support for allowing cities with high housing costs to freeze increases in rent. Next slide. API adults largely disapprove of Trump. 75% view him unfavorably, and this unfavorability is high across every group except for API Republicans. And this unfavorability has increased 15 points since December of 2024. So any kind of honeymoon period bump that we saw in December of 2024 with the API Data, AP NORC survey, that has disappeared by August of 2025. We also find that 30% of APIs don't know enough about their representative in Congress to give an opinion. We see this as an important opportunity for outreach and education from various sectors. When it comes to the two parties, API adults trust the Democratic Party more than the Republican Party on a range of issues, except for immigration and crime, where neither party has an advantage. Importantly, neither party is seen as addressing the needs of young voters. Next slide. So in terms of the top issues, let's go to the next slide. The API community prioritizes affordability above all else. The next highest priority is jobs in the economy. And to some extent, priorities vary by age. We're not going to go through all of the slides here. If you can download the slide deck that has, I believe, 120 plus slides. But let's go to the next slide. So in terms of the most important issues facing the country, you see cost of living and inflation, and then jobs in the economy take the top two slots. Now, jobs in the economy usually is seen as different because it's not just about cost of living, right? It includes jobs, it could include tariffs, it could include so many other aspects of economic development and economic growth. Healthcare comes next, essentially tied with preserving democracy. And then you see the rest of the issues. The way this question was worded is that people could choose more than one in terms of the most important problems facing the country today. Importantly, abortion and repro is at the bottom of the list, whereas when we saw in 2022, and even to some extent in 2024, it was higher on the priority list. Next slide. Now, we also asked about the most important problems that you and your family are facing. And the results are similar, except healthcare, you see, jumps here and essentially tied with jobs in the economy as a number two issue. So that's something to keep in mind, especially as the reconciliation bill, as well as other policy changes when it comes to healthcare, might have significant implications for our community. This is not to say that the other issues are not important, but these are the ones that are top of the list, followed by preserving democracy, environment, climate change, education, and immigration. And you see the rest of the list there. Next slide. Top issues by ethnicity. Next slide. Here are some of the key takeaways. Cost of living and inflation are consistently the most important problem among all ethnicities, and all ethnic groups except Japanese and Koreans list jobs in the economy as second. For Japanese Americans, preservation of democracy is an equally important issue. And for Korean Americans, healthcare ranks as the second most important problem. More generally, healthcare ranks as a top 3 issue for most groups, and abortion, repro is consistently low among all ethnic groups. Education also ranks near the bottom for all ethnic groups except for Vietnamese Americans. Next slide. If you look by sex or gender, let's go to the next slide. No huge differences here, except when you look at healthcare. Healthcare ranks as the second most important issue among women, but fifth among men. Preserving democracy is the third most important issue for both groups. And you can see some additional differences both in the slide deck as well as in the crosstabs. Next slide. In terms of the top issues by age, let's go to the next slide. Cost of living and inflation ranks highest for all groups. For younger populations, and if you look at 18 to 34, as well as 35 to 49, the top issues are consistent: cost of living, jobs in the economy, healthcare, preserving democracy, and immigration. Preserving democracy is a higher priority as you go older among age groups. Education ranks higher on the priority list among young adults ages 18 to 34, but it's still a middle priority issue. It does not break 20% even among this group. And then finally, abortion or repro rights ranks consistently low among all age groups. Next slide. Views on the reconciliation bill. Okay, I'm going to slow it down a little bit here, where API adults are highly persuadable on the bill. That's what our survey experiment indicates. When only the benefits of the bill are mentioned, 41% favor, 43% oppose. It's essentially split. When only healthcare spending cuts and enforcement spending increases are mentioned, 75% oppose, 20% support. Just look at that difference. It's pretty dramatic, and when you look at the graph, you'll see how dramatic it is. And then when both costs and benefits are mentioned, it comes closer to as if they were only the costs were mentioned, right? So this suggests that people are supportive of the tax benefits, but not if it comes at the costs of cuts to health spending. And this likely will be a preview of what we might see in 2026. And what this suggests is that if benefits are more dominant on the minds of voters, they're more likely to see the reconciliation bill favorably. But if costs are more dominant in their mind, or if there's a balance of costs and benefits, they're more likely to oppose the measure. Next slide. We also see some notable results and variation by ethnicity. Compared to other groups, Filipinos are disproportionately more likely to favor the reconciliation bill if only the benefits are mentioned. And Japanese American respondents are far more likely to strongly oppose the reconciliation bill compared to other groups. There's some notable results by age where these framing effects are disproportionately present among those aged 18 to 34, so that when only the benefits are mentioned, those aged 18 to 34 are more likely to be in favor than opposed. Also, when only the benefits are mentioned, those aged 65 plus are more likely than average to be strongly in favor of the bill. Again, suggesting very strong framing effects, which the literature shows when there's low information and awareness about a particular policy measure, framing effects can be quite large. And then finally, bipartisanship, you don't see as much framing effects among Democrats and among Republicans, which makes sense. But among independents, you see the biggest swings in support based on framing. Next slide. And so that's what you see here in general, right? I mean, essentially, if you see opposition as represented in the orange, either dark orange, which is strong opposition, or light orange, which is weak opposition, The opposition is much greater when you have only the costs mentioned or when both benefits and the costs are mentioned. Next slide. If you look at it by group, this is where you see when only the benefits are mentioned, you see support across all groups except for Democrats. Next slide. When you look at when only costs are mentioned, you see some pretty strong opposition, except among Republicans, right? So this is the framing effects, not only in the overall population, but among subpopulations as well. Next slide. And then when both costs and benefits are mentioned, the only group that supports the reconciliation bill is API Republicans. Next slide. Now, we also asked about components of the reconciliation bill. We didn't call it the reconciliation bill, but we asked if people would support measures in Congress that would achieve the following. Next slide. So here are some of the key takeaways. API adults largely oppose saving $1 trillion over 10 years by reducing Medicaid for low-income people. And there's very low support and strong opposition among all race ethnicity groups. Most opposition also comes among the youngest, so that might be surprising. And the most support comes from Republicans. API adults are mixed on requiring people to work at least 80 hours to attain or maintain Medicaid eligibility. And there's more support in this from those age 65 plus and among Republicans. Next slide. So these are the key components. And you see the opinion essentially is split on the work requirement. And there's a fair number of people that say neither support nor oppose. Even here, there's likely a lot of room for persuasion because you don't see a lot of strong opinion on that issue. Reducing Medicaid benefits and saving $10 trillion over 10 years, you see net opposition with 36% strongly opposed. And then increasing the number of people without health insurance by 17 million over 10 years as an effect of the bill, you see 44% strongly opposed and overall 60% opposed. Next slide. Now here are some breakdowns by party ID, and I'd summarized it earlier, so I'm not going to spend a lot of time. We can go back to it in the Q&A. Let's go to the next slide. So similarly here, when you see in terms of cutting Medicaid, so that's the point of finding that I pointed out, age 18 to 34, strongly opposed to saving $1 trillion over 10 years by cutting Medicaid for low-income residents. Next slide. Next, we have measures of favorability. Let's go to the next slide. Essentially, Trump's honeymoon period is over. I mentioned this earlier. So his favorability went from 27% in October 2023 to 37% in December 24 to 24% now. So it's essentially tied with where it was back in October 2023. By ethnicities, Trump is viewed very unfavorably across all groups, but if there's a silver lining, his highest support numbers come from Filipinos, but even there, it's only 37 favor, 62% oppose, or 62% view him unfavorably. By partisanship, only Republicans view Trump favorably, and interestingly, his favorability is actually slightly lower among independents than it is among Democrats. By gender, there's no significant difference in favorability, and API adults are more approving of their state governor than they are of Trump, of their congressional representative, or of the Supreme Court. Let's go to the next slide. So looking at that state governor finding, what's interesting is that those living in states with a Democratic governor have a more favorable opinion, but it's a bare majority have a favorable opinion of their state governor with 37% unfavorable. Those living in a Republican governor state have only a 39% favorable rating with 46% unfavorable. When it comes to their congressional representative, it's split with 31% having a favorable opinion, 34% unfavorable. Importantly, 30% don't know enough or haven't heard enough to form an opinion, suggesting a major gap and an opportunity for constituent outreach and voter education and outreach. Finally, with the Supreme Court, only API Republicans hold a majority favorable view of the US Supreme Court. This is the first time that API Data has asked about Supreme Court favorability, and we will seek to track this in future years. So let's go to the numbers. Next slide. So this is a summary slide on favorability. So if there's anyone who has favorability, it's state governors. And again, we saw that there's a difference based on whether it's a Democratic state governor or a Republican state governor. For representative in Congress, opinion is essentially split, with 30% not knowing enough to form an opinion. SCOTUS is viewed unfavorably, and Trump is viewed very unfavorably, with 60% holding very unfavorable views and overall 75% holding net unfavorable views. Next slide. So if you look at Trump's favorability, a lot has been made about maybe greater favorability among younger populations, and we don't see evidence of that. In fact, if there is slightly higher favorability, it's among those 65 plus, but even there, it is strong. The very unfavorable is 57%. Republicans are the only group that hold a favorable opinion of the president. Next slide. When you look at Supreme Court, again, like I said, this is the first time we've been asking about this, but you see favorability as low and more unfavorable than favorable across the board, except for AAPI Republicans. By the way, when it comes to Trump favorability, you see unfavorability among men as well as among women, and that also goes against the dominant narrative about Trump doing better among men than among women. Next slide. In terms of views of party performance, next slide. So here are the key takeaways. Overall, as I'd said earlier, Democrats do better on most issues except on crime and on immigration, where opinion is split. Across issues, a sizable percentage say they trust neither party to do a better job. And that ranges from about 20% to 40%, as you'll see in the next slide. And there's dissatisfaction across all API groups about the extent to which the Democrats and the extent to which Republicans are addressing the needs of younger voters, although Democratic Party does slightly better than the Republican Party in this regard, and there's greater dissatisfaction on this measure among men than among women. Next slide. Okay, there's a lot here. And essentially, well, I'm just going to skip over the slide in the sense that there's a lot of text, but you'll see it in the data, and you can review the summary if you download the slide deck. So let's go to the next slide. So if you look across issues about which party do you trust to do a better job, you see that Democrats do better than Republicans on most issues until you start getting to immigration and crime. So even on addressing the rising cost of living, 34 to 18, you see a net Democratic advantage. But even there, 40% say neither party is doing a better job, right? And so there's two ways one can look at it. One is net Democrats are doing better, but if you look to the right, where the neither party, I mean, on almost every issue, you see dissatisfaction with what the parties are offering in terms of those issues. Next slide. So in terms of the quality of political representation, I will read each of these in its own way because it's important, and we'll see some more details. So we asked about whether they agree or disagree whether Republicans in Congress are doing a good job of being a check and balance on the executive branch. We see that 63% disagree, with 50% strongly disagreeing. Next, Republicans in Congress are doing a good job of addressing the needs of younger voters. 57% disagree, with 40% strongly disagreeing. Next, Democrats in Congress are doing a good job of providing a very different vision for the country's future. Opinion here is split, but you have close to a majority disagreeing. 48% disagree, with 27% strongly disagreeing. So this is in line with what we've seen more generally in the electorate, with the frustration of a lack of a clear vision from the Democratic Party. And then finally, when it comes to addressing the Democratic Party addressing the needs of young voters, you see close to a majority, 49%, disagreeing, with 25% strongly disagreeing. Next slide. And if you look at this by key breakdowns, we have ethnicity breakdowns in our slide deck and in the crosstabs. But here you see men more likely to disagree than women when it comes to saying that the Democratic Party is addressing the needs of providing a different vision for the country's future. And you see dissatisfaction across the board by age and even by party ID, right? So you have 43% of Democrats saying that Democrats in Congress are not doing a good job of providing a different vision for the country's future. Next slide. In terms of whether Republicans are doing a good job of providing a check and balance, you see disagreement across the board, and even among Republicans, you only see a bare majority, 50%, saying that the Republican Party in Congress is doing a good job of being a check and balance on the executive branch. Next slide. Next, in terms of affordability and cost of living, let's go through the numbers here. So housing, healthcare, and food are the three most difficult items to afford for API adults. And importantly, the majority of API adults support government intervention to improve the cost of living in different ways. 58% when it comes to freezing rent in cities with high housing costs, 84% to support government limiting the cost of medication, 82% support government limiting costs of medical care, 68% support increased government funding for low-income college students. So to the extent that someone says, to what extent are API adults supportive of quote-unquote socialist measures? If you think of pretty heavy government intervention or government support, on affordability, you see strong support across the boards. Now, there is some variation in support for freezing rent increases in cities with high housing costs. Lowest support for rent freezes is among Chinese American adults, 40% are in favor, but still more favor than opposed, with the rest divided. The majority of Democrats, Independents, and Republicans all support allowing freezing rent increases in high housing cost cities. So this is pretty remarkable. Let's go to the next slide. So this just going through the data that summary slide went over, right? Housing or rent is high in terms of the items that are difficult for people to afford, followed by healthcare, and then food and groceries. Whereas education, taking care of elders, and childcare are lower on the list in terms of what thinking specifically, right? If you look at the question about yourself and your immediate family members. Next slide. In terms of support for policies, again, what this graph shows is what I'd read before in the text. Very strong support for government intervention when it comes to limiting costs of medication as well as medical care. But you still see majority support, right? So you see 68%, that's supermajority support for increasing government funding for low-income college students. This is particularly important when we see Pell Grants and proposed reduction in Pell Grant support in the FY26 budget. And then freezing rent in high-cost cities, you see that a majority there support that. That's 58% support. Next slide. So here are some breakdowns by ethnicity, and this is where you see lower support among Chinese Americans. Next slide. When you look at breakdowns by gender, by age, and by party ID, and this is where it's remarkable, where you see even among Republicans, you see majority support for freezing rent in high-cost cities. Next slide. In terms of support for low-income college students, you see support across the board. So it's not just younger API adults that support this. And you also see support among API Republicans, right? More support than opposition to this measure. Next slide. In terms of government spending priorities, this replicates a question that we had asked earlier with Associated Press and NORC. So let's go to the next slide. So in general, API adults think that healthcare, environment, and education is not getting enough funding support from Congress. And they think that there's too much being spent on the military. The exception is NHPIs who are split on that issue on military and defense spending, and Filipinos who think essentially we're spending about right. One of the things I would say that appears as a pattern across the board is Filipino voters seem to be a bit more on the conservative end, even though a majority still, are on the progressive end, if you will. You see greater instances of conservative opinion among Filipinos across various indicators. Let's go to the next slide. So here we are. So we see very strong support. Essentially, 70% say that the government is spending too little money on improving the healthcare system. We also see similar opinion when it comes to education and on the environment, whereas on military and defense, it goes the other way. Essentially, if you look at the reconciliation bill that was passed, as well as any new budget considerations, what is being proposed in Congress and by the president is at odds with the values and priorities of API communities. Next slide. So in terms of improving the healthcare system, spending too little, we see this across the board, including among API Republicans. Next slide. Improving the nation's healthcare system. Similarly, you see API adults saying that we are spending too little, and this is across the board. And even among Republicans, you see 40% saying that we're spending too little. Next slide. In terms of defense, you see most constituents saying that we're spending too much, except for 65 plus APIs, Republicans, and when you look at the ethnicity data in the slide deck that you download or in the crosstabs, you'll see Filipinos also less likely to say that we're spending too much on military and defense. And some of this makes sense given the greater proportion of Filipinos that are tied to the military in the United States. Next slide. So in terms of immigration and citizenship, we have a lot of data here. I'm going to try to speed this so that we can get to Greg's comments as well as Q&A. So let's go to the next slide. The big thing here is that majority of the API adults think that Trump and Republicans have gone too far when it comes to immigration. 64% saying that they've gone too far, whereas 25% saying that they're on the right track. And there's opposition to a whole bunch of measures. Let's just go to the data. Let's go to the next slide. So here, when it comes to particular components of immigration enforcement, you see strong opposition. So let's start at the bottom. The strongest opposition is allowing immigration enforcement agents to wear full face masks and refuse to provide identification. This is something that's been widely covered in the news, especially in the Los Angeles area, but more generally across the country. 47%. So by the way, so if you add 59 and 12, right, that's 71% oppose people refusing to identify themselves or wearing full face masks. You also see close to a majority strongly opposing and well over a majority opposing sending immigration enforcement to public places such as parks and restaurants. You also see 56% opposing with 40% strongly opposing deporting undocumented immigrants, even if they've lived crime-free in the US for more than 10 years. And then finally, a similar proportion, 56%, oppose using the military and National Guard to support immigration enforcement. This is important, right? Because in the past, we saw split opinion in the community in terms of support for deportation in general for people living in the country illegally, but you see opposition to particular tactics that are seen as going too far. Next slide. Oh, let's go back to the previous slide. Right, and this is the, whether it's whether they have gone too far or it's the right amount. You see that most groups think that the Trump administration has gone too far. Next slide. Finally, we have some questions on economic priorities as well as inclusion and rights priorities for members of Congress. Let's go to the next slide. So I'm going to skip this slide and just go to the data, the interest of time. So we see that there's very high priority when it comes to economic issues to ensuring that our elders can retire with security and dignity. So 41% say very high priority. If you combine that with a high priority, you have well over 3/4 saying that. You also have a supermajority saying that it should be a high priority or a very high priority to protect high quality public education as a pathway to economic opportunity. Next are some issues that may be lower on the radar now, but very well could emerge in the future as big issues. Helping workforces prepare for the rise of technologies like AI. You see a majority, so 53% saying that it's a high priority or very high priority, but only 23% saying it's a very high priority. And when it comes to helping small businesses and entrepreneurs succeed in a modern economy, less than a majority say that it's a high priority or a very high priority. Next slide. Next, when it comes to issues related to rights or the inclusion of APIs and whether these should be priorities for members of Congress, let's go to the next slide. We know we included these questions, by the way, because in our engagement with the Congressional Asian Pacific American Caucus, these were identified as some potential priority areas. Now, rather than reading in the text, let me just go to the next slide. So if you look at the summary slide here in terms of support for inclusion and access policies, very high priority when it comes to preventing racially motivated hate crimes and hate incidents, right? So you have 78% saying that it's a high priority or very high priority, with 45% saying it's a very high priority. When it comes to birthright citizenship, this was a question wording, protecting the right of anyone born in the United States to be a US citizen. You see 63% saying that this is a high or very high priority, with 40% saying very high. Now, other issues are lower on the priority list, but still nevertheless decently high, where we see below majority saying high or very high for promoting the inclusion of Asian American and Pacific Islander history in schools and museums and ensuring language assistance for people with limited English skills. Next slide. So I believe that's where we are, and we're going to turn it over to Greg to give his thoughts and take based on all the insights that we have from these survey findings.
Hey folks, thanks Karthik, as always, for your partnership in putting together this community survey and obviously queuing all this information up. It's good to see everybody. Again, my name is Greg Orton. I'm with the National Council of Asian Pacific Americans. A few reflections just on the data. We were involved in sort of scoping, I'm sure Karthik talked about earlier. But when we all kind of zoom out and think about what are the priorities of the Trump administration, just based on what we have observed as community members, obviously, tariffs come to mind, tax cuts for the rich, which were accomplished back in May with the reconciliation bill. And then obviously, more recently, what's taken the limelight has been sort of a heavy focus on immigration enforcement. Now, whether it's a concern about undocumented immigrants or crime in general, which has been the rationale that's been provided by the Trump administration time and time again, it really sort of highlights just how out of step these priorities are with where our community's at. Thinking about the economy and recognizing that that continues to be top of the list for so many members of our community. A weak job market plus a weak mortgage market is going to create real economic downward pressure that we're going to continue to feel. And for many of you who are on earlier webinars, we raised this as a concern when the big, beautiful bill was being discussed, that we would likely see some of the impacts later on. And so we are now here, as well as the fact that a number of the tariffs and decisions made on that front really have taken hold. And we're really starting to see again that the impact that it's having on the American economy. And one thing I also want to point out when we talk about how we prioritize or what the community priorities are, there was some mention of repro justice and other topics being lower on the list. I want to make sure people understand that we are not saying that these are not important issues. API Data and others have done polling on topics like that, and there's overwhelming support from our community on those issues. But when it comes to how our families are prioritizing the issues that are most important right now in this moment, given everything that's happening, certainly cost of living, housing, the economy matter. When we shift gears to healthcare, I think it's particularly important to recognize, and I know it was mentioned earlier, the reconciliation bill removed over 17 million people from Medicare, right? And there's a current government shutdown fight that's looming. It's about 2 weeks away, so everyone should be paying attention to that. Currently, there are members of Congress who are fighting to make sure that they work to restore coverage under Medicare, and also there are tax credits that are provided to low-income people to make healthcare more affordable. And currently, the Republican plan is to cut that even further. And so it's a moment in time in which I think all of us are kind of called to make sure we're weighing in, to make sure that members of Congress understand that the cost of healthcare is important to the AA and HPI community, and we have to make sure our voices are heard. And the other thing I would say is America continues to have the most expensive healthcare system in the world. And so it raises that simple question of what is being done to address those concerns. Thinking about the reconciliation bill, clearly tax cuts for the rich were okay, but simple tax credits for low income folks, apparently that's something that is debatable for many people in Congress. For education, another important topic for our community, a recent occurrence that I think everyone should be aware of is the Trump administration recently announced that they're cutting all funding to NAPCs. And so these are institutions of higher education that work within our community to make sure that our students have access and have opportunity to not just learn, but also then leverage those skills in the job market. And so taking away millions of dollars from those programs is going to have a massive impact. And we've raised the flag on that when the Trump administration first announced that back earlier this year. But today we are actually seeing this being put into action. A couple lessons learned from all of this, from the data that was shared, and I appreciate Karthik pointing this out. That 30% of our community that doesn't have enough information to have an opinion about their member of Congress screams to me that Congress has to do better. And I know for years, many of you on this webinar and many of us at NCAPA have been talking about this, where neither party does a particularly good job when it comes to actual meaningful engagement with our community. We know this to be a fact. It's always a last minute addendum or perhaps a footnote or sort of a last minute effort by a member of Congress or by a party to do that outreach. And so if 30% of our community doesn't even know who the member of Congress is, to me, that's actually more of a red flag for Congress than it is for us. It doesn't mean we're off the hook though, because I also think another thing we have to keep in mind for our community organizations like NCAPA, API Data, the members of NCAPA, as well as local and state organizations, is we have to do more to continue to engage our community. Just because we may not be high on the priority list of members of Congress or political parties doesn't mean that we are absolved of any responsibility to get engaged ourselves. All of us feel the impact of the decisions that are being made in Washington, D.C. And if we choose not to engage, there's only so much we can be mad about when we choose not to be sort of in the game, as people like to say. So I think, again, members have to do a lot more, but we also have to make sure we're doing our part to make sure that we're being heard. Now, I'll close on this as far as calls to action. I had mentioned that the government shutdown is just a few weeks away. It is imperative that every member of Congress hears from their constituents about these priorities and make sure they understand that, one, shutting the government down because they can't agree over who we should be providing more affordable health care to, that is an unacceptable outcome, in my opinion, certainly for Congress. And so, having worked in Congress for quite a while before I came to NCAPA, hearing from constituents does matter, right? Getting phone calls, getting emails, either in the district office or in the DC office, all of that's tracked, all of that's tabulated, all of that's shared with the member of Congress, and it can influence a vote. Every member of Congress right now is hearing from different constituencies about what's in the CR or what's not in the CR, and our community should make sure that we're doing the same. And so we'll make sure, one thing I'd close on also is, and CAPA's, made sure that we're providing resources to community members about how to be advocates, right? How to raise our voices, how to engage with our members of Congress. We'll make sure that everybody has that. We'll continue to look for ways to help educate the community on how to do this kind of work. But right now, the government shutdown is about to happen. Nobody wins when the government shuts down. I know there's a lot of narratives and a lot of debate over leverage and politics and all of that, but all of us know this. When we get caught up in the politics of it, it's oftentimes our community that's bearing the brunt of that, right? Putting food on tables, figuring out healthcare costs, making housing affordable. So again, I appreciate everybody making the time to join us and excited to share this information with you all and continuing the conversation.
Awesome. Thank you, Greg and Karthik, for your thorough presentations and your
overview of the analysis of the landscape. We have some questions in the Q&A, and folks keep them coming in as we try to get to them all. The first one being, uh, Karthik, can you explain more about healthcare that was listed as a concern on the survey? Was it like specifically affordability, access, cultural competence, or something else?
Yeah, so without nerding too much on survey research here, and there were a couple of other questions too. Like there was a question that I had answered in the Q&A on on the needs of young voters. So this is where some people may get frustrated because what you want is to be able to dig deeper and to be able to understand. But given, I mean, what I'll say is both Greg and I are on the board of Amplify API. And I'll say that this is a historic moment. I would encourage you all to not only uh, learn from and share widely the results of our survey, but if you are a researcher, if you are a community organization, to consider running your own survey. It is a lot more affordable to do nationally representative in language surveys of our community. Now, that said, there's only a limited number of questions you can ask in a survey like this. I've run other surveys that have run in the millions of dollars where we can ask a lot more questions. The survey does not cost millions of dollars, right? So for Amplify API, you should be able to run a nationally representative survey of Asian Americans and Pacific Islanders for less than $50,000. That is huge. That is a game changer in our community. That is why we are able to do surveys like this with NCAPA, surveys with the Associated Press and NORC, surveys with API Vote and AJC. I'm giving that context because, yeah, we don't know. For example, it would cost another question if you wanted to drill down specifically into healthcare. But I would encourage those who care about that issue to field a survey. I know that everyone's struggling right now, but I know that there are plenty of people in the health space that could probably pool their resources and come together and to run a health survey to dig deeper into that issue. And I would strongly encourage you to do that because the way the Amplify panel works is that people get asked every month different questions. And it would be great for them to be asked about different types of questions to be able to drill down, right, in terms of what that means when it comes to healthcare. But that said, based on past surveys and and even from NCAPA, I'll go to you and Greg back on this too. I think it's in some ways all of the above. The big thing I would say when it comes to healthcare is, and going back to the reconciliation bill, there's all this talk about Medicaid and insufficient attention to the Obamacare subsidies and those essentially expiring and what that will mean in terms of skyrocketing premiums. That is something that is a ticking time bomb that will likely land on us in the next few months. And I think it's important for people to connect the dots and understand who was responsible for that or what policy move was responsible for that. I don't know, Greg, and too on healthcare, if you want to dig a little bit deeper. I know we have APCHO and many other members of NCAPA that are like deep policy nerds on this issue.
Yeah, that's right, Karthik. I would just double click on that, right? The Affordable Care Act tax subsidies that were provided to low-income communities to make healthcare more affordable. That was by design. That was a huge kind of main pillar of the Affordable Care Act. Those tax subsidies are about to expire. The government shutdown in 2 weeks. Sort of one of the big fights revolves around whether or not to extend those. Obviously, allowing them to expire means that healthcare is going to become significantly more expensive for millions of Americans. And I think for all of us, it's a simple question of, is that reflective of our priorities as one a community and as a country, right? Like this idea that using the tax system to incentivize particular action or make something more affordable has always been done, right? I mentioned earlier the reconciliation bill was intended to lower taxes for many Americans, including many of us, but obviously a lot of that benefit was centered on the richest Americans. There's now this debate happening over whether or not we should simply extend tax subsidies for poor people to get healthcare access. And to me, it's a very sad commentary on where we're at, but obviously the consequences and repercussions are massive. And that's particularly why, like I said earlier, it's time for us to get engaged, make sure that we're raising our voices, and members of Congress understand as they're approaching this very, very important vote in 2 weeks, this is where our community stands on this issue.
Think I don't have anything to add. I think y'all covered it. Thank you both. Um, and there are a few questions here that are related to cross tabulations. So I think if the team can drop in the chat, for example, like how does the Filipino response compare by age group or PI data specific? So we're gonna have the team drop the crosstabs in the chat. I'm gonna skip to Elizabeth's
Oh, but one quick
question.
thing, but
Oh
one
yeah.
quick thing I'll just say, we don't have large enough sample sizes to be able to differentiate within Filipinos or even among PIs to separate NH and PIs. And even on the PI data, this is a classic thing. The sample sizes are small, so interpret that with caution. The errors are much bigger, right, when it comes to that. But we in general believe that it's important to put out the point estimates rather than making NHPI data invisible. Generally speaking, folks, what we have seen in our data, a lot of this is because of Amplify API, but also other products, right, by NORC. NORC, by the way, is the global leader when it comes to social science research and survey research, right? I say this as someone who's done my own original survey data collections. They have an Amerispeak panel that also has a significant size of NHPIs, and what they have found over the last couple of election cycles is more conservatism among NHPIs than among Asian Americans on average. That's something that's important to acknowledge. And in conversations with organizations and Pacific Islander leaders, the way a lot of them make sense of that is because of the importance of religion and Christian conservatism within a lot of Pacific Islander communities, that helps explain some of the greater conservatism. But still, generally speaking, we see a split community among NHPIs, whereas more of a left-leaning community among Asian Americans in general.
Do the findings related to the general unfavorability of current heavy military spending in comparison to investing in domestic issues like healthcare speak to perhaps a greater criticism of US funding of imperialism, war, genocide abroad, such as the continued funding of Israeli defense and arms?
So with this data, we can't say because we don't have questions about Israel Gaza. But that's a good question. We can look to a prior survey to see that. Generally speaking, I would say the fact that you see this across the board in terms of age, we know that that issue is more salient among 18 to 34. But the fact that you see across age groups, you see the sense that there's too much military spending, that it's unlikely to be the dominant explanation. But that could explain why you see a weaker sense of too much spending among 65 plus than among 18 to 34. So it's likely playing a role, but probably not the biggest role. Likely the biggest role is generally people think we should be spending more on human capital, like healthcare and education, than on military capital.
Yeah, I would add that this debate over military spending versus domestic discretionary spending has always been there. The U.S. has always spent a tremendous amount of money on military, and all of that kind of is captured in either direct military spending, foreign aid, et cetera. And for many of us, we've always been advocating for the fact that all these other priorities domestically that impact our families, our friends, our communities, they matter just as much. And there's certainly a debate to be had whether or not U.S. spending in general has been skewed too heavily towards military spending. But I agree with Karthik that it's important to recognize that the way we ask the question, we want to be careful not to overinterpret, especially because that critique of military spending has always been there.
Mhm. Yeah, I would plus one. I feel like it's a general trend culturally in our community too that they prioritize um spending on social services than war, given our community, many of it are immigrants from war. Uh, the next anonymous question is, I'm surprised to see concern for gun control so low for the API community. Is that a decrease from where the community might be after the Atlanta spa shootings, or do you think most people attributed that to hate and less to guns?
So so part of it is gun control is an issue. We've API data, we have asked questions about where people stand on gun control. And by the way, consistently over time, they've been very strong advocates of gun control, except for Filipinos who are less strong in their support for gun control. And again, I think there's at least one, if not many, dissertations to be written about attitudes on the military, attitudes on gun control, and Filipinos. And by the way, some of the conservatism in Filipinos is not a static population. And also Vietnamese Americans, we see opinion change over time. So what the parties do and the extent to which they mobilize and the kinds of messages that they use to appeal make a difference. And there's a fair amount of reporting in Nevada of the Republican Party making significant inroads, including the National Election Poll, which only does surveys in English and Spanish. That's a limitation, but it indicated that Filipinos majority in Nevada went for Trump. So that's something to keep in mind, overall. But to the issue of gun control, the bottom line is our community is strong supporters of gun control, but it's not a high salience issue. And especially at this time, I think it's going to be hard for, given the broad and deep nature of threats that our community faces, especially on issues like healthcare and also what they were promised in terms of cost of living going down. They're not seeing that, and that just dominates over everything else. So again, going back to Greg, it's not that these other issues are not important, but it's just the severity of the challenges economically and on health are so high that these other issues fall by the wayside.
I want to say though, that doesn't mean that there isn't concern for gun control and that there isn't efforts to, um, work on gun violence prevention in the communities. It's just that once you're putting it up against healthcare and cost of
Absolutely.
living, yeah. Uh, Greg, did you have anything to add to that, or
No, I think that's spot on.
yeah? Another anonymous attendee asked you, Greg. You mentioned NCAPA has advocacy resources for community members to contact their representative. Could you provide a link to that information or talk more to that?
Absolutely. We will make sure that those resources get shared out and follow up to this webinar. Our team is, along with NCAPA member staff, help put together sort of a toolkit to explain how to advocate with members of Congress, things to keep in mind, frequently asked questions, things of that nature. We're also in the process of working on a congressional directory that connects a lot of the survey data, population data with contact information when it comes to your member of Congress. And so we'll make sure that once that's completed, that's shared with everybody. Because again, our goal, I want to be very transparent, is to get more of our folks to engage with Congress, make sure that they hear from us, because far too many times other communities are mobilizing, making sure their voices are heard. Our community's learning that. I think we're building our civic power in that way, but we have a long way to go. And we want to do everything we can to help facilitate and encourage that.
Yeah, I'll just add as a member of API Data, as a member of NCAPA, and I really value the amount of attention and care that NCAPA, including its coalition members, but especially NCAPA staff, do to track what is going on. It is such a dynamic situation. So I don't know, Greg, if NCAPA is open to new membership applications, but certainly we have seen the value, right, of the kind of coordinated and centralized work, not only among staff, but also so many NCAPA member organizations, including OCA, to just really, it has been such a value and benefit to be able to benefit from that. So I hope that, if there are funders on this call, that you think about the kind of value that a coalition like NCAPA provides. No, it's not always easy to do coalition work, but where else can you find like 40 plus organizations from across the country serving a bunch of different communities, getting their act together and trying to coordinate and do this difficult work together? It's pretty incredible. No one paid me to say this. I truly believe it in my heart. So
Thanks, Karthik. And yes, we're always excited to talk to potential new members. The door is always open. our goal is to make sure we represent that really diverse cross-section of our community. So if you want to chat after this, we'll make sure that my contact information is shared as well.
So, okay, one thing that was in the Q&A too, but it went off. I think it's been answered. Uh, people ask, how about Filipinos and kind of getting together and trying to figure this out. Greg, I mean, I believe NAFA is part of NCAPA, is it? Like I don't know if you can speak to that in terms of either Filipino only organizations or orgs led by Filipinos in NCAPA that might be able to take on this question.
Yeah, I mean, we do have a couple Filipino American organizations as part of the coalition. And look, I want to make sure we're not singling out a specific part of our community in a sort of harmful way, right? Like I think to me, it feels like a reflection on sort of the slow maturation of our overall community. Like there's always going to be differences of opinions. And while yes, it sort of suggests to us that maybe we should spend time thinking about how we engage, how we spread more education. I think I don't want to just have a knee-jerk reaction that, oh, this is bad or this community's, trending in the wrong way. So groups like NAFA, PhilPro, there's other Filipino American organizations out there that I know are doing really important work in organizing youth or other parts of their own community. It is important for us to identify them and encourage them to engage in some of these conversations. And so if you're on this call and looking for more of that information, again, we can make sure we connect after this to connect you.
Great. I'm going to take the final three questions. So Megan Baker is going to be our last question, and I'm going to need you guys to quickly run through these answers. First is, how do we work with our legislators on moving health policy towards more equitable access when health corporations have such a strong hold over costs and directing how the market runs?
So I'll
Uh,
just say quickly, just quickly on this. I mean, this is where I think right and left can come together. Like, right, you're seeing this administration and the president in particular talking about things that otherwise might be thought of as socialist policies, including limiting prescription drug care costs, and also now talking about rolling back some of the loosening of restrictions on direct consumer advertising when it comes to prescription drugs. So I think that we should not view everything through a partisan lens, and there could be opportunities to have some cost relief and also increase regulation and scrutiny on big pharma as well as other aspects of big insurance when it comes to healthcare.
yeah, I would just
Thank
add
you.
it is an uphill battle. I don't want to suggest that it isn't, but where I always come down on this is when it comes to our community and advocating for our issues, if not us, then who, right? If not you, then who? We have this opportunity to slowly build some of this muscle memory of being advocates, and I think every one of us who's on this call has an opportunity to practice that and then also encourage friends and family to do it as well. I said earlier, and I meant very seriously, congressional offices track constituents who they hear from, and it can move a vote, it can move a position. It takes time and it takes work. And I know a lot of us have jobs outside of being able to call our members every day or advocate on these issues, but it does actually matter.
Thank you. And then real quick, the survey had many more Asian American respondents than NHPI respondents. Are there efforts underway to include more of our Pacific Islander voices and communities in future surveys?
Yeah, so I'll take this. Yeah, thank you for flagging that. We will go back to Amplify API. As I mentioned, Greg and I are both on that board. Um, it is um, it is slow going, and it's not for lack of trying to push for increasing NHPI sample size in the Amplify panel. So we will go back and see what is viable, even now, so that we can increase sample size and what the cost implications are. But lesson very well taken, absolutely, and we need to push harder. Right now, my sense is that there's not enough to produce more than 200 N total, which is still lower than at least what I would feel comfortable in terms of overall margin of error. But we will get back to you and we'll dig deeper within Amplify to see what that roadmap for build out is.
Thank you. And then maybe in your wrap-up remarks, you can include this question, but the last question is, how do we stay engaged in this work given the loss of federal partnerships with things like the White House Initiative for NHPIs? And so, yeah, given the state of our lack of access to parts of government too. Like, how do you see our work moving forward in the next year? And that can close us out.
I would say, again, I'm not trying to sugarcoat anything. Things have gotten much more difficult to do the kind of work that we've historically done. It's caused many of our members, and myself included, to have to really think about what it looks like to engage in federal policy debates in this day and age. And yes, there are far fewer entry points when we already had so few to begin with. And I suppose the real question for us is, given this sort of absence or given sort of the lack of opportunity, how do we make our own momentum? How do we generate our own sort of forward progress? And I do think it starts with community engagement. I truly believe that there's so much more we can do. We're heading into an election year. And so typically, and again, I want to make sure I'm clear, I'm not telling people how to vote, but members of Congress, the government tends to pay a little bit more attention during election years. So let's take advantage of that. How do we actually find connections with state and local groups and national groups like NCAPA and our members to really think about a more unified voice during next year to make sure that our issues, our concerns, and our priorities are actually heard?
Yeah, I'll just add to say it's important for us. I hate to be that person to say data and evidence matters, but it does. We put in so much effort and work into this, but this will not mean a lick of a difference if we do not engage with our communities. A lot of times, our communities carry mythologies in our own minds about where we are on issues, and sometimes, that, and it's not always say the data show our community be more progressive than what people assume. Sometimes, we see that our community shifts on some of these issues. It's a dynamic community. It is a community with relatively low partisanship. People have pressing needs that they see, and they're open to anyone who comes up with a viable solution for them. At the same time, even if, say, someone is identified, say, with the Democratic Party, you can't just take their interest and support for granted. You have to engage. But I'm hoping that community organizations on this call will take this data and convert it into things that are meaningful for their constituents. I'm hoping that funders will support things, more data collections, but importantly, translating data to action. And this is where NCAPA and NCAPA member organizations, everyone is like running on fumes at this point. But at some point, if we do not resource this enough, we have no prayer of making sure that our community has influence and impact. And so I'm really hopeful that people who come to sessions like these to get more educated and informed, that they commit to doing something about it and talking to someone who may be connected to money, or maybe you have some resources yourself to contribute more to organizations that are going to be important for the fights ahead.
Thank you, Karthik and Greg. And with that, we will close out today's webinar. Thank you all for your engagement and participation. Please continue to stay up to date with these latest findings and other community organizations that you could get involved with via the AAPI Data website and the NCAPA websites. And please feel free to reach out with any questions that you may have to Karthik, Greg, or if you have my contact, myself as well. Thank you all and have a great rest of your day.